figuring out what to eat during chemotherapy can feel like a total minefield. It is, without a doubt, one of the biggest challenges for patients and their families. So today, we're going to cut through the confusion. We'll use an evidence-based guide to help you make nutrition an active, powerful part of your treatment plan. Okay, so here's our game plan. First, we're going to talk about why eating is so tough in the first place. Then, we'll dive into what your body really needs to stay strong. After that, we'll get into some super practical tips for managing those side effects, tackle the tricky world of supplements, and wrap up with the absolutely critical topic of food safety. All right, first things first, let's just acknowledge what so many people are going through and dig into the real reasons why it can feel almost impossible to eat well during treatment. So why is it so hard? It's a question that gets right to the heart of the daily struggle. And honestly, the answer is baked right into the nature of the treatment itself. You see, chemotherapy is designed to go after cells that divide really fast, which is exactly what cancer cells do. But here's the catch. It can't always tell the difference between a cancer cell and other healthy, fast-growing cells, like the ones that line your mouth, your stomach, and your intestines. And it's that collateral damage that unleashes this whole list of side effects, turning something as simple as a meal into a monumental task. So now that we get the why, let's pivot and talk about solutions. Let's talk about fueling your body's fight. Because when you're going through treatment, the normal rules of healthy eating kind of go out the window. Your body's needs change a lot. And this right here, this is a huge mindset shift. All that standard advice about low-fat, high-fiber diets, it often has to take a back seat. Right now, the number one priority is giving your body enough fuel, enough calories and protein to handle the treatment, repair healthy tissue, and just plain maintain your strength. Now, the numbers you're seeing here aren't just guesses. They're evidence-based targets from major clinical groups, specifically the European Society for Clinical Nutrition and Metabolism, or ESPN. They give us a clear scientific baseline for what we aim for, focusing on energy to prevent weight loss and lots of protein to preserve that all-important muscle. Let's really zero in on this protein number. This is a big deal. Your body is basically a construction zone right now, constantly working to repair itself. And protein, that's the lumber, the bricks, the raw materials for the whole job. Hitting this protein target is absolutely fundamental to staying strong. Okay, let's get into the really practical stuff. We know the problems, we know the goals, so how do we actually do it? Let's look at some specific, actionable ways you can use food to outsmart those side effects. When it comes to nausea, the whole game is to never let your stomach get too empty or too full. Both can be huge triggers. So eating 5 or 6 mini meals keeps things on an even keel. Sipping liquids between meals means you're not filling up on water instead of calories. And hey, things like ginger and peppermint have been used for ages to help calm a queasy stomach. And this chart really nails a simple but powerful idea. Temperature and smell matter a lot. Hot foods release way more aroma into the air, right? And when you're feeling nauseous, strong smells can be your worst enemy. That's why so many people find that cold foods, like a sandwich or a yogurt, are just so much easier to handle than a hot, steaming meal. So what happens when your body's hunger signals just go offline? Well, you have to outsmart them. You start eating by the clock, not by your cravings. And the goal is to make every single bite count. This is the time to embrace calorie and protein-dense foods. Think adding avocado, nut butters, cheese, or olive oil to, well, just about anything you can. All right, this brings us to a really, really tricky subject. One that causes a lot of confusion. Dietary supplements. It is so natural to want to do everything possible to help your body. But we have to look at what the science actually says. And this is the critical question we have to ask. It sounds totally backwards, right? But a growing body of research shows that some high-dose supplements might actually get in the way of chemotherapy and stop it from working as well as it should. Just take a look at this data. It comes from a really important study called the DELCAP trial. And what they found was pretty shocking. For breast cancer patients, taking certain individual high-dose supplements like iron and B12 was actually linked to worse outcomes. The thinking is that high-dose antioxidants might accidentally protect the cancer cells from the chemo. So what's the bottom line? The main takeaway from all the research is this. Do not start taking any new vitamin, mineral, or herbal supplement without talking to your oncologist first. A standard once-a-day multivitamin was shown to be okay, but for anything beyond that, you absolutely need to have a conversation with your care team. Okay, let's move on to our final and, frankly, non-negotiable topic, food safety. This isn't just about avoiding a little stomach bug. This is about protecting yourself from a potentially serious infection when your immune system is at its weakest. A really common side effect of chemo is something called neutropenia. All that means is that your white blood cell count drops. Think of your white blood cells as your body's personal security team. When their numbers are low, bacteria from food that your body would normally handle just fine can suddenly become a major threat. So being extra careful with food becomes a crucial part of your treatment. These are the hard and fast rules to lower your risk. A good mantra to remember is cook it, wash it, or peel it. Anything that's raw, unpasteurized, or sitting out at a self-serve place like a buffet or salad bar just carries too high a risk of contamination. Being super vigilant here is one of the most proactive things you can do to stay healthy. So let's pull all these threads together. The goal here is to stop seeing nutrition as just another chore and start seeing it as an active part of your treatment. The core strategy is simple. Focus on calories, make protein a priority, use food to manage those side effects, and be incredibly cautious and communicative about supplements. And please, remember this, you are not doing this alone. Your cancer care team is your #1 resource. Don't be afraid to ask for a referral to a registered dietitian, especially one who specializes in oncology. They are the experts who can help you build a plan that's tailored just for you. So I want to leave you with this question to think about. How can you make nutrition an active part of your treatment plan? Maybe think about just one thing you learned today that you can bring up with your doctor or dietitian this week. Because taking that one small step is how you begin to harness the power of nutrition to support you on your journey. Going through chemo is tough. And eating? Well, that can feel like a whole separate battle. Does food feel more like an enemy than a friend right now? It's a common struggle, but your body needs fuel. And get this, about 40% of patients change how they eat right after diagnosis because of side effects. So let's talk about how to get the nutrition you need to stay strong and manage those side effects. Eating well isn't just for comfort. It's a super critical part of your treatment plan. First things first, you've got to shift your thinking from healthy eating to treatment-focused eating. So forget the usual rules. Right now, it's all about calories and protein for energy and healing. Here are the numbers to aim for. Hitting these targets helps you maintain your weight and muscle mass. But I know hitting those targets is easier said than done, so let's get into some practical strategies. First up, a poor appetite. This is probably one of the most common struggles out there. The trick is to eat small meals on a schedule, not just when you feel hungry. Make every bite count. What about nausea? It's a huge barrier to eating, but the right foods can really make a difference. Think bland and salty, like crackers. And a great tip? Try eating colder foods. It minimizes those smells. Okay, another tough one, mouth sores. This is where texture and temperature are absolutely key. So go for soft, cool foods. Even just using a straw can be a total game changer here. Now, beyond side effects, we have to talk about safety, especially with a weakened immune system. This stuff is non-negotiable. Separate cutting boards, cook meats thoroughly. It's all about avoiding infection. And here's a really important heads up. Some supplements can actually be harmful during treatment. Things like St. John's wort, even certain vitamins, can interfere, so always talk to your doctor. The big takeaway here, your diet is a powerful part of your treatment. You are not in this alone. Your oncologist and a dietitian can build a plan that's just for you. They are your team. So think about it. What's one question you can ask your care team about nutrition this week?